A storm is brewing in Ethiopia. The heart of the nation, its healthcare system, is trembling. Health workers, the very backbone of this system, are poised to strike. They have been pushed to the edge. Their demands are simple: fair pay, decent working conditions, and the security of health insurance. For years they have toiled tirelessly, their pleas falling on deaf ears. Now they are ready to raise their voices as one. The clock is ticking. The date etched in everyone's mind is May 11th, 2025. This is the day the strike is set to begin. Doctors, nurses, and other healthcare professionals across the nation will lay down their tools. It is a decision born out of desperation and fueled by years of neglect. The Ethiopian government has until then to avert a catastrophic collapse of its healthcare system. The situation is dire. Ethiopia grapples with a severe shortage of healthcare workers. The World Health Organization recommends one doctor for every 1,000 people. Ethiopia barely has one doctor for every 10,000. This stark reality underscores the fragility of the healthcare system. It exposes the millions of Ethiopians who depend on it to a precarious fate. The potential impact of the strike is nothing short of catastrophic. Hospitals and clinics across the nation could be forced to shut their doors. Essential services from emergency care to routine checkups will grind to a halt. The consequences for the most vulnerable, children, the elderly, those with chronic illnesses, are unthinkable. The demands of the Ethiopian health workers are not unreasonable. They are not driven by greed or a desire to cripple the nation. They are the cries of human beings pushed to their limits. Doctors, nurses, and other healthcare professionals are the unsung heroes of society. They dedicate their lives to caring for others, often at great personal cost. In Ethiopia, these individuals earn a pittance. A doctor, after years of grueling study and training, takes home a meager monthly salary of 12,000 to 13,000 Ethiopian birr. That's a mere 90 to 100 US dollars. It is an insult, a slap in the face to those who hold the lives of others in their hands. Beyond the meager salaries, they are forced to contend with appalling working conditions. Hospitals and clinics are often ill-equipped, lacking even the most basic supplies. They work long hours, stretched thin by the sheer volume of patients and the lack of adequate staffing. Their pleas for better working conditions, for the tools and resources they need to do their jobs effectively, have been met with silence. The lack of health insurance is another bitter pill to swallow. These individuals who dedicate their lives to caring for the health of others are themselves denied access to quality healthcare. They are forced to rely on the very system they struggle to keep afloat, a system that is woefully inadequate. The silence from the Ethiopian government has been deafening. While protests rage on the streets and pleas flood social media, the authorities seem content to sit idly by. Their inaction is a betrayal of the very people they swore to serve. It is a dangerous gamble with the lives of millions. The Ministry of Health has acknowledged the protests. They have even gone so far as to speak of drafting plans to address the concerns of the health workers, but their words ring hollow. They are empty promises devoid of any real commitment or urgency. The health workers have heard it all before. They have seen promises broken and their concerns brushed aside. They have witnessed the slow deterioration of the healthcare system, the growing burden on their shoulders. They know that this time, silence is not an option. The situation demands immediate action, not empty rhetoric. The government must engage in meaningful dialogue with the health workers. They must present concrete solutions, backed by a genuine commitment to improve the lives and working conditions of these essential workers. The time for complacency is over. The Ethiopian government must recognize the urgency of the situation. They must understand that the health of a nation is inextricably linked to the well-being of its healthcare workers. The demands of the health workers are not unreasonable. They are the demands of a workforce that has been pushed to the brink. They are the demands of a nation desperate for a functioning healthcare system. The government must act now to avert a national health crisis. They must engage in open and honest dialogue with the health workers. They must address their concerns with concrete solutions, not empty promises. The world is watching, waiting to see if the Ethiopian government will rise to the challenge. The lives of millions hang in the balance. The time for action is now.